Good evening. My name is Whitney Wells, and the title of my MSN project is Geriatric Heart Failure. My population of interest is, of course, geriatric patients with heart failure. Heart failure is responsible for many hospitalizations within this population. This population is underrepresented in clinical trials. My issue of concern is medication adherence. The 5 sub-roles of the advanced practice health nurse are the researcher, consultant, administrator, educator, and clinician. The important role here that will be focused without this project is the educator, which provides health education within the nursing framework. Healthy People 2020 has a systematic review regarding medication adherence that states text messaging interventions have shown to increase medication adherence in patients with chronic diseases such as heart failure. Some interventions that will be mentioned throughout this project include education on the importance of taking heart failure medications as prescribed, education on each prescribed medication, including the mechanism of action, class, dose, route, time, and side effects, and also implementation of programs designed to encourage medication adherence. The literary review article chosen for this discussion is Heart Failure in the Elderly. This article states that 80% of heart failure cases are among the elderly. As mentioned earlier, acute heart failure is responsible for many hospital admissions within this population, and this population is inadequately represented or altogether excluded from clinical trials. Some factors that affect this population are aging, lack of physical activity, comorbidities, frailty, cognitive or mental issues, polypharmacy, and lack of resources. 3 scholarly articles regarding to this topic are a systematic review, which states that medication adherence interventions and how they improve heart failure mortality and readmission rates. Most interventions included within this study involved medication and disease education efforts. The study proved that improvements in medication compliance made a huge influence on decreasing hospital readmission and mortality among heart failure patients. The second article was a randomized controlled trial, which looked at pharmacists delivered health literacy intervention. Results were measured by adequate versus inadequate health literacy and impaired versus non-impaired cognition. The interventions yielded no significant difference in patients with cognitive issues, but did reduce hospital admissions for low literacy participants, which is why pharmacist component was included within the project. The third piece of evidence is a systematic review that describes medication adherence as the most important self-care behavior to prevent acute heart failure exacerbations. The review found that medication adherence is an important modifiable factor in reducing poor health outcomes within this population. The rapid appraisal checklist was followed to review these different articles. The systematic reviews included criteria that were consistent with the issue in question. The information was used from multiple resources and was reviewed. Biases and limitations were addressed, and recommendations for further practice were made. The randomized control trial used true randomization. All investigators were blind to treatment assignment, and appropriate statistical analysis was used. This public health pyramid shows primary, secondary, and tertiary prevention efforts. At the bottom, which is the largest, you'll find primary, which consists of basically education. In the middle is secondary, which is providing screenings. And at the top is tertiary, which is prevention of further complications. This project focuses on primary prevention. The most effective interventions within the sub-roles for this particular project include the consultant being able to provide pharmacist medication reconciliation, provide low literacy aids. The clinician can directly assess baseline and monitor for changes in status among the population, and also they can prescribe medications. The researcher can conduct research based on the needs of the population and apply it to the community, and also provide recommendations for further research. The administrator can oversee interventions provided to patients in the community to encourage medication adherence. The most effective intervention utilized for this project is the educator, which can teach on healthy food choices, exercises that can be done with limited mobility, general information on medications, the importance of taking the medications and sticking to the regimen, and also symptom management. The theory utilized for this particular project is the Kolb's cognitive learning theory. This theory focuses on key principles of reflecting, learning, and applying the information taught. This particular theory focuses on the experience as molding the learning process. The needs assessment yielded that more research on interventions for this population is needed and medication adherence interventions are needed. The educational plan is to create a heart failure management course for heart failure patients and their caregivers within the community, geared to teach patients the importance of sticking with the treatment regimen given at discharge. The proposed educational plan includes a pharmacist-led intervention, which involves collaborating with providers, and also a registered nurse and case management-led interventions, which provides personal connections to the patients and also provides disease education and lifestyle modification in addition to medication adherence interventions. The patient handout that was given at the project was simple and used accurate terminology. According to the Flesch-Kincaid readability scale, a 13 or 14-year-old at grade 7th or 8th grade should be able to read this handout with ease. This handout provides general heart failure information, a discharge checklist, lifestyle information, simple drug class definitions, and symptom tracking information. And this is a link to the handout. Birmingham, Alabama is the location used for this particular project. It's miles north of the Gulf of Mexico, is about 151 miles, is hilly and stretches about 15 miles along the Jones Valley. Mining was one of the biggest industries in Birmingham. The area is best known for its coal and limestone industry back in the 1800s. It was one of the largest hit areas after the 1930s Great Depression, and a lot of people ended up unemployed. However, through all those milestones, Birmingham is currently the largest city in Birmingham and also has a great healthcare, transportation, and engineering field for people. The local government structure includes the Mayor Randall Woodson, who was sworn in on November 28, 2017. His goal is to create an ecosystem for entrepreneurship to thrive in a city built on the steel industry. The city also consists of council members. Each council member heads a district within the city. At the bottom left is a picture of Mayor Woodson and I. Key leaders within the community are Dr. William Fernandes, who is the CEO of UAB Hospital. Since UAB is one of the nation's top medical institutions, it only makes sense for Dr. William Fernandes to be a key leader. Dr. Mark E. Wilson is the Jefferson County Health Department CEO. He oversees a $55 million budget with a mission to prevent disease, assure quality health care, and protect people against public health threats. Richard Shelby is our Republican Congress representative. Doug Jones is our Democratic representative for the state of Alabama. District 6, Republican Gary Palmer is over the district that is in Birmingham, Alabama. And he is a Republican. Congressional District 6, this is a map of the area that was included within the project. Health policy, the building environments and public health workforce to support physical activity among older adults was the policy utilized for this project. This policy was utilized because of its direct link to geriatric heart failure patients. The ANA Code of Ethics, Provision 7 states, the nurse in all roles and settings advances the profession through research and scholarly inquiry, professional standard development, and the generation of both nursing and health policy. Health policy advocacy. Nurses can advocate for policies by performing in the consultant sub-role, present policy to the state representatives along with evidence-based practice to support the policies, and also collaborate with other community leaders because we're stronger in numbers. Birmingham, Alabama has about 200,010 people according to the 2017 U.S. Census, and about 3% of this population are 65 years of age and older. 5 most common major chronic diseases are asthma, COPD, lung cancer, high cholesterol, and high blood pressure. The windshield survey consists of the community being comprised of mostly African Americans. One side of the community where the project was implemented was highly kept while the other seemed to be neglected. There's a lack of businesses and most of the buildings looked abandoned. There were no fully functional recreation centers within this specific community in Birmingham, and no readily accessible health care was there as well. The first 2 interviewees in my informant interviews had very similar opinions. They all looked at the fact that there were no resources for patients or people within the community. The RN interview had a different perspective. She felt as though the readiness to learn was the issue within the population in the community. But among all 3 of them, they all had the same theme of education and resources as being the highest priority. These are 3 community diagnoses. The most important that we will look at for this project is the third one. It consists of the risk for ineffective health management among geriatric heart failure patients in the community related to inadequate medical facilities, educational programs, and emergency responders. The most one that we'll focus on for this project is educational programs. These are 3 feasible population interventions. The first 2, of course, involve educating on heart failure medications in detail, and also the last one, implementing a program designed to encourage medication adherence. And this is all based on the information presented within this PowerPoint. The outcomes or objectives are listed below. By the end of the teaching project, the participants were expected to at least have these outcomes or objectives learned. The most important one, I feel, is the demonstration of understanding each medication's importance in heart failure management and how to take each medication as prescribed. The project was, of course, to create a heart failure management course for patients and their caregivers within the community, which is, of course, geared to teach the patients. It included assistance from a nurse and a pharmacist, which was behind the scenes. And it also involved helping the patients to track their blood pressure and weight, and it educated on heart failure disease management as a whole as it tied into adhering to the prescribed medications. The resources used was my Ports Pathology 9th edition textbook, blood pressure and daily weight logs, blood pressure cuffs and scales, and pill organizers were provided. A pharmacist which acted behind the scenes. The pharmacist was not actually at the project, but they did assist me with making sure that I had the adequate resources. The audio-visual projector was used to display the information, and of course the educational handout. I did not actually have to use a HIPAA waiver. Barriers included health literacy, patient motivation, lack of doctor follow-up, a willing pharmacist to actually be present, and resources to buy blood pressure monitors for each patient. Fortunately, blood pressure monitors were provided by the community center where the project was held. The team members included just myself, 1 nurse, pharmacist behind the scene, and 1 tech person that assisted with the projector. The key stakeholders are the healthcare personnel within the community, CEOs like Dr. William Fernandes and Dr. Mark E. Wilson, and also the community, which is the most important stakeholder in all of this. This project was designed to teach the patients and the participants of how important it is to stick to their medication regimen. This information can be utilized not only for heart failure, but for all chronic diseases. This program was widely appreciated by the participants, and I'm so happy to be a part of this. Thank you so much for listening, and these are my resources.